Hi there guys, and welcome to today's live stream. We're going to be talking about the best approach to treating back pain, the best non-surgical approach to treating back pain. We're a little bit biased, but in this video we're going to explain why and also tie this into some exercises that you guys can do at home as well. Hopefully you're going to find this video really helpful. If you're new to the channel, please do consider subscribing. We go live every single weekday. Today is going to be no exception. We're going to do Q&A at the end of the live. So if you've got any questions on your back pain or the topic of discussion for today, then please post those in the comments. We've got Lara on the other side of the camera, and with that being said, we'll get into today's live stream. Okay, so I thought I'd just kind of give you a brief overview of what we're going to discuss today. We're going to go first and foremost, just a brief one with the spine over here through what back pain is, just to remind you guys. Then we'll go through what's on the board behind me in terms of the treatments, what we think is the best approach to treating back pain. And this is lower back pain predominantly that we're going to be talking about today. And then I'll kind of tie that in because that's where many of you guys will know about our Back in Shape program, and the protocols and the rehab side of things is something that we do at the same time in clinic as treatment, and it's also something that kind of mimics the treatment at home. So it's not as good, but it is still sort of the best way we can mimic what we're doing in the clinic with rehabilitation at home. So if you can't get to the clinic, you're going to have some useful information in the back end of this video as well, and the Q&A we'll get to at the end. So first and foremost, what is back pain? Now, if you've watched any of our videos before, we've discussed this, but as a brief overview, we're talking about a compression-based injury. Most of the time, the main way in which this structure fails is doing its daily task, which is load bearing, resisting the load of gravity. And normally this is a repetitive stress. It's something that it's just constantly been being used in a poor way. Maybe we've been slouching for extended periods with sitting and working from home more recently, or maybe we just don't look after ourselves on a daily basis, and this thing starts to fail through repetitive insult. And then it finally goes, maybe we're putting our socks on, or we're emptying the bins, or putting the child in the car seat, and the back finally goes, and then we have an injury as a result of a failure to deal with the compressive load of gravity, possibly in an isolated event, which has been the final sort of straw that broke the camel's back. So that's how the back gets injured. That's what it's doing. It's resisting that load of gravity and allowing us to move around and interact with our outside environment, interact with the world, and transmit the organs, the vital organs, around from A to B so we can function in society. One of the common things that we will get when we get lower back pain or lower back injury is going to be muscle spasm in this region, which, a little hint, is one of the primary misdiagnoses. Most of the time you go, my back's sore, I've hurt my back, it'll be, oh, it's muscle spasm, it'll go away. Well, it kind of doesn't in a lot of cases when these things have built up over many weeks, months or years. We can also get things like sciatica, trapped nerves, etc., which will result in pain going maybe to the glutes, maybe to the hamstring, maybe further down the leg and into the big toe, depending on which exact area has been injured. And it's also important to bear in mind that certain nerves that come out of this little section here, we've got the L5S1, which is a common area to be injured in the lower back. Different parts of that same little nerve, so the same disc injury that you might have, but someone else also has, will result in some cases in different symptoms. So we don't want to get, in certain cases, too caught up about the fact that it's in my big toe, but it's in this person's other area, for example, because generally it's going to be coming from the same region, and that same region of injury can result in different types of symptoms. So we need to be mindful of that. Even to the point where if we have a disc injury at that L5S1, it can swap sides. So you might get sciatica down one leg, and then you might get sciatica down the other leg instead. And a lot of patients get confused and think, oh, is this something different? It's got worse. It's just changed. It's just that a little different part of those nerves have been irritated as a result of the same injury being flared up. And we use this example of a surface wound, which is often very easy to visualize, whereby we've got a little cut on the hand here, and if we pull the scab off here, it'll pus over here, and if we pull the scab off here, it's going to pus over here. And there might be different structures that can be irritated in those two areas, but the same injury is being flared up. So it's important to just have that in mind, because back pain can really play on people's minds, especially if it's been going on for a long period of time. So that's really important. Now, if we get into what do we actually do, and this is obviously our approach in the clinic, we're biased, but our main goal in the clinic is to be able to provide people with the best non-surgical alternative for back treatment, and that's why these therapies have been put together. That's why this approach has been put together, and that's why other treatments haven't made it in. We've tried other therapies to feed them into this process over the years, and they maybe aren't better than what we currently have. So that's important to bear in mind as well. So we want to work on principles. That's the best way to do this, because it means that things are most broadly applicable, and you'll see how these principles are replicated in things like the Back in Shape program as well. And you'll also see that plus rehab is on the side here. Just because you have treatment doesn't mean you can get away with not doing any rehab, because quite often, as we mentioned, it's that repetitive assault over the years. You can't just have treatment and all those. So for example, you might have treatment for 1 hour a week, you come in for a session, or some people we have a little bit more intensive to start with, and they might come in for two-hour sessions in a week for a short period of time. Those 2 hours don't undo the other 166 hours in that week that you might be abusing your back. So rehab and education is of vital importance, and actually can make a really profound difference, which is what led us to really push the more resources into our Back in Shape program. So just bear that in mind as we're going through these things as well. So the first thing we want to work on is injury healing. We have an injury in that lower back that we need to get healing. Second thing is going to be, we want to unload, we want to take pressure off that section of the spine, because it's that compression that has caused that tissue to fail, and then it's constantly compressing. For example, if this chair leg that I'm sat on here was fractured and broken off to the side, I've got to take my pressure off it and then start worrying about repairing it. I can't keep my pressure on that area and expect the bending leg or the broken leg to start to straighten back up on its own. We have to do a bit of unloading to take pressure off these structures. Even if it's periodic and temporary, it helps these tissues recover. We want to make sure that there's not unnecessary rigidity, and this can be locally at the joints in the spine, but also the muscle function. We want to improve the muscle function around those joints. So for example, the hips can move a little bit better and take stress off the lower back. On the topic of joint mobility, one of the common ones that's mistaken is people say, well, you've got to go and mobilize that lower back. You've got to get it moving a little bit better. And we want to do that in a safe way, but excessive forward and backward bending, exercises like the child's pose, things like knee hugs, things like the cat camel. I was speaking to someone on YouTube in the last week or so, and they were saying, oh, well, I got given these exercises for it was for mobility, to help move the area, to get more oxygenation into those tissues, and that's fine. But if you're doing it in too much of an extreme way, which these cat camel, which these knee hugs, which these child poses do, you're going to stress those structures that are trying to heal. So we want small amounts of pressure coming off, rather than big, gross, large, full body movements that really take the joint range of motion to extremes. So for example, with that child's pose, just pulling everything around until it gets to the end is not advisable in the short term, in our opinion. So we don't do that in the clinic. As one might think. So what treatments do these include? Well, there's really sort of 4 different treatments that we use. The first one for healing, we're using the laser. We're using the class 4 laser therapy. If you guys caught us in the early part of lockdown, we actually had the laser on the back here on the shelf for some of the videos, just because we brought it home. It's useful to have. It helps with healing of any sort. It's a really, really awesome bit of kit. And from a point of view of having a patient, some of you will unfortunately have experienced this, where you cannot move because of your back pain. You're really, really stuck. You can't do some of these other things. You have to get that person, get a little bit of laser on there to calm down the inflammation and get that body to start healing again, get that exchange of nutrients in and around that injured area. For example, treating the actual injured area, not the area that hurts. In a lot of cases with lower back, that's where people fall foul. They treat the wrong area. So we need to target the right tissues that are injured. So that's where we use the laser. And this is important. That's a class 4 laser therapy. It's not class 3B laser, which is substantially weaker. I won't get into the bits and pieces on that, but suffice to say, a class 3B laser is up to 500 milliwatts, and class 4 is a lot stronger, so we can actually deliver proper doses at the target tissues rather than just something that warms the skin. So very, very important to distinguish between those two. The next one is unloading the soft tissues. Well, in the clinic we use IDD therapy, or spinal decompression, and that is literally lying down. It's a really awesome table. Some of you guys will have seen it. And it's just basically taking pressure off these discs very gently. It's a small amount of movement at this disc. It's nothing extreme like we mentioned earlier with those other exercises. It's a small amount of targeted movement to just unload these particular structures down the bottom here. It has coincidental benefits for people with things like anterior pelvic tuck and pressure on the facet joints as well, which are coincidental rather than designed. It's really targeted to unloading those discs, but that is a fantastic one that works really nicely in conjunction with the laser that we do. And then we get onto the joint mobility and muscle function. And in the early parts of treatment, we're going to be working predominantly through those hips, because it's those hips, as many of you will know, that are taking the brunt of movement, or should be taking the brunt of movement when we've got a back injury, so we're not putting too much excessive movement through this section of the spine. So we want to get those hip muscles nice and flexible. We want to get them functioning much more effectively. If there's any sort of descending irritation coming down from that nerve to those muscles, causing them to tighten up or go into spasm, it needs to be done as well. The primary effect is going to come from this work, but it's still worthwhile doing some work. And that's where we use the vibration gun that's just behind me up here to get to work on those muscles to really help just increase circulation through them, break down some scar tissue so they get a little bit more plastic, a little bit more pliable, a little bit more like an elastic band rather than a piece of rope. And some of you guys will notice this. I know I've spoken to a few people on our Facebook group and on virtual consultations over the period of time and in clinic, that certain muscles feel like when they go to stretch them, they just pull and then it just kind of stops like a rope, whereas other muscles maybe on the other areas of their body that aren't affected are very elastic. You can feel it gently stretch out and then reach that point. And using things like the vibration just helps get those muscles working a little bit better. It's all about restoring things, restoring mobility in the joints, restoring function in those muscles, and then unloading those discs gently and carefully to make sure that that back can be given the best best opportunity to heal. And then we've got the rehab on the side. Bear in mind, none of this involves any injections or any surgery or anything like that. It's all non-invasive treatment. The rehab on the side is there to replicate these things, and that's what we give patients from a point of view of that homework to do on a daily basis, and it must be on a daily basis. If you're to really resolve back pain, you must be doing things daily, and what we often find is that those that adhere to the rehabilitation will have dramatically better results than those that decide that they don't have time to do it. There's always needs to be the commitment to do it. And quite often people will come in and say, do you know what, I had a really, really busy day at work. The last 3 days I haven't been able to do the rehab. And that is exactly the wrong frame of mind to be in. It's a case of, I've had a really, really busy day at work. I've been doing substantially more wrong for my back as a result of the busyness at work, and therefore I must make time to get my rehabilitation done without fail on those days where I've been particularly busy and quote unquote not had the time. You need to make the time on those days, and that's why putting ourselves second to the other tasks on a daily basis, we've ended up getting into this position where we've got recurrent back pain. So it's a very important one, and quite often when you break it down you go, oh, that makes sense, because my rehab is there to oppose the bad things I'm doing on a daily basis. So it would make sense that if I've had to do more bad things over the last few days, I should have made time to do my rehab. And this rehab is not too arduous. You know, if you're doing our phase 1 work, which we often get we always get patients to start off with in the early stages of treatment, it takes you about 15-18 minutes. And yes, the first few times you're getting used to technique, so maybe a touch longer, but once you've got the routine down and you've got the technique there, it's literally about 15 to 18 minutes worth of work. Everyone can fit that in. It doesn't matter how busy you are, especially if you've got a back problem, you must make the time to fit it in. And then other progressions of that, things that many of our Back in Shape members will know, sort of the phase 2 and phase 3 work, that again, when you move into it, it might take you close to 40 minutes, 45 minutes getting used to the technique. And then we bring it down and we start to get more efficient, and we're doing it in 20-25 minutes. And everyone can make time for that. And the consistency is what will really improve your results in terms of getting your back pain solved. And again, many patients that come into the clinic or people that we've got in the Back in Shape will have the looming prospects of potential surgery, which is why we're working really hard to provide these resources for you guys so you can actually avoid the need to do that. And there's lots of things that we can do if we can just understand our back and start doing more of those right things. Now, how does the Back in Shape rehab, how does the rehab that we recommend patients in the clinic, which is essentially incredibly similar, There might be some nuanced changes because we have x-rays for patients in the clinic or imaging that allows us to tailor it and tweak it a little bit more in a little bit more of a refined way. But how does that mimic these things? Well, first and foremost, you guys will be using the icing. You won't be using heat anymore on the back. That's a really important one, and that's going to improve the healing. We're not going to have a congested area with excess inflammation and poor fluid dynamics. So using the ice on that lower back is going to improve that healing time. We're getting rid of more of the waste products by using that ice for 5 minutes a good few times a day to help flush that area through. So that's improving the healing. We've got the stretches in the early part, and we've got the strengthening exercises a little bit later on that you guys are doing, which are improving the function and competence of the muscles and improving the mobility of the joints, both below and above the spine in the area that we're injured. And then we've got that towel exercise that we love and recommend so often, which really helps decompress and take pressure off those joints, unload the spine, and something that often people find is really a very, very good relief, and something we recommend you guys keep as a default exercise whenever you've been out doing anything abnormal. Maybe you've spent an afternoon in the garden, or maybe you've been on a long bike ride. You jump straight on that towel, you decompress, you unload the previously injured tissues, and make sure that things recover effectively. So that's pretty much it. That's our non-surgical approach to back pain. That's how we treat it. Those are the principles that we use to treat it, and obviously the technologies that we use at the same time. So hopefully you guys have found this interesting, and we can get into Q&A. I'll just switch the mic over.
Yeah. Good morning, everybody. Okay, before I just jump into questions, just really quickly, do you mind just telling everybody how long the treatment sessions are if they do come into the clinic?
Yeah, so the treatment sessions, first time patients come in, we always treat in a more conservative manner. So obviously we've got the consultation and stuff and the examination, and we need to get all that under wraps. So the first treatment, you might be in the clinic depending on sort of whether we're doing x-rays, etc., maybe about 30 minutes to 40 minutes worth of treatment, and then that builds out to sort of 40 minutes to an hour depending on the individual, and each of those sessions are about that long. When we start off with the decompression, the IDD therapy, we often do that for a shorter period of time, just to help the patient sort of feel what it feels like to get that spine unloaded. Quite often, if you've got things like sciatica as a result of sort of more serious herniated discs, or we've got a degree of stenosis, actually being on that IDD table, the decompression table, the symptoms literally disappear. It completely goes. And if you're someone who's had that nerve pain, that really bad nerve pain that's just been there constantly for the last 6 months, and then you get on the IDD table, it's a bit annoying because the sensation will completely go, and the patient will be like, oh my gosh, this is the first time I've been in, without pain in my leg for as long as I can remember. But when we put you back up, we have to put you back on gravity. We can't leave you on that table for the next couple of weeks while you go through the recovery and the healing process. So that is something to bear in mind on the more severe cases. But yeah.
Okay, great. Kate has asked quite a few questions here. Really good. She said, sure. How and when would you start the treatments? How long between each treatment? How do you know when to go for the next one? Would it be beneficial to have help alongside the rehab? And would traveling in, etc., undo the good that the treatment has done?
I'll address the last one first, because that's a few questions. As we've been doing the Back in Shape, obviously it's something that we've put out there a little bit more since lockdown. And we've had a few people from time to time message us and saying, or maybe I've done a virtual consultation and they say, hey, can I come in? And when we've got a longer distance of travel, my personal opinion is actually go ahead and do the Back in Shape stuff for a little bit longer first, because the travel is going to potentially bother your back, and what we really want is the best possible outcome, the most lasting effect from treatment. So if you can get a bit of work done at home and strengthen up that back, get through the phase 2, maybe even into some of the phase 3, and then come in for treatment, you're going to find that after you've finished the treatment, you've got a lot more support and protection for your back. Because the big problem in phase 1, and when patients first come in, is that you might find the pain fluctuates on a daily or weekly basis. It comes and it goes, etc., which drives people up the wall. And it's the fact that there's not the muscular support and protection, and the movement patterns are bad, that mean you keep re-injuring yourself. So if we know that you've gone through sort of phase 1 and phase 2, and maybe you're even in phase 3, we know objectively that your body is much, much more effective at getting you from A to B. It's much, much safer for your back because you've got more support, you've got good movement patterns, you've got good flexibility. So if we finish a lovely treatment, you're more likely to keep that effect and allow that effect to build in your body over the next couple of hours and day or so that you can benefit more from the treatment. Whereas if you came in and you're not able to walk and you're sitting on a train or in the car for 4 hours to get to the clinic, and then we do a treatment, then you sit in the car and on the train to go back for another 4 hours, for example, it's difficult for me as a being in the clinic or as a clinician to say to you that it's worth coming into the clinic. I'd say, do you know what, wait a second, build up the work at home, do that phase 1, phase 2 in particular, and phase 3, really start to build up a bit of strength and then come into the clinic a little bit later. That's really my approach. What were the other questions? It was about how frequently do people do treatment?
Yes, and how long in between each treatment, and how do you know when to go for the next one?
Generally what we're doing is in more longer term cases is we have a more intensive spell. We might see patients twice a week. Some people, where we are in London, we get people flying in from all different parts of the world, people going from the Middle East, etc., from Australia, those sorts of things, and they might come in for a much more intensive spell. So they might do 2 weeks, 3 times a week, or 4 times a week, or 1 week for literally bang, 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 bang. Mm-hmm. There's a point where the economics of that start to maybe outweigh the physical benefit. But if I'm in trouble myself, I will get on the table every day. But it's my table, it's our table. So I can do, I could do it myself. So all things being equal and money not being an issue, I would go on there every single day. I'd have the vibration every single day. I'd have the laser every single day. I'd have the decompression every single day because those things are helping me. It's a case of the financials, that's really the reality of it. It's a great treatment. You should be doing the back in shape every single day. The treatment is there and it's fantastic, and that's my take on it.
Yes, and even if you aren't in pain, severe pain, we do use it ourselves as a maintenance to make sure that you don't get back pain and keep your body in really good condition. Yeah, I mean
that's the beauty of these treatments. When you're trying to do these to create these sort of systems, etc., you want something that really, really works and really, really helps people. And also another big benefit is that you can use your own stuff, if that makes sense. And it's always weird when you go to a medical practitioner and they wouldn't recommend what they're having to their own parents or their own person. And with this, 100%, any family member that's here, get on the table, all these sorts of things, get on the decompression table, have some of the vibration. I've even got 2 of these guns at home with my family. Whether they use them enough, there's another kettle of fish, and I know some of you guys watch this, so use it more. But this stuff, it's when it's coming for treatment, obviously it's a financial thing, but they are great, and you can have them regularly.
Yeah, absolutely. Karen's asked a good question here. She said, "How do you approach treating somebody with back pain if they have had surgery before?"
Say that again.
So if somebody has had surgery on their lower back, let's say, how would you approach treating somebody who's had maybe bolts in their back? Or
you need to really understand their case and be a lot more conservative in the early stages. You need to test them properly. We do decompression testing in the clinic. We do obviously the laser is incredibly safe. So the only thing that we need to be mindful of with the laser is tattoos in certain areas, because the ink in the tattoo is dark, obviously, and that absorbs and you get more of a heating effect with the laser, which is not as good. It's not good when someone comes in for a treatment, they've got bad back pain, they've got no visible tattoos, they go, okay, right, we're going to go on to laser, they take it off and they've got a whole back covered in tattoos, and you're like, oh no, this is difficult. So that's kind of the main thing. You just need to be more conscientious. You need to understand their particular surgery. When it's things like bolts and hardware's involved, it's a lot more difficult. We need to have a discussion, etc., about the specifics of that particular case. But if we've had things like injections, then it's a lot less so. Yes. But you'd have to do that with a patient that's got a severe pain as well. You have to take into consideration. But the point of these treatments is that where we adjust them down for each individual person and tweak things for each individual person. That's no different as to whether you've had surgery or not.
Yeah. And we can treat people that have had surgery, but that is why we always encourage people, before you go for that serious intervention, just try our treatment, because for a lot of people that's kind of all they need, and then they're good to go. And why not avoid surgery if you can?
Yeah, exactly. And a lot of patients, that's a sort of a self-proclaimed objective, is to avoid the need for those sorts of things. And you can normally get a pretty good indication straight off the back within a first session or two as a gut feeling as to whether this is going in the right direction for you or not. That's the nice thing about the treatment.
Wonderful. Okay, that is it for today.
Awesome.
I just wanted to ask you whether you could let everybody know about the giveaway on YouTube that we are running. A winner will be announced on Friday.
And
the draw closes Thursday evening.
So the draw closes Thursday evening. It's to win the Venom unit up here. Getting the mirroring a little bit wrong there, and that's the vibration unit for the leg. I mean, reality, you can put it anywhere. If you've got tight muscles on the chest after a workout, you can put them on there. If it's on the buttocks, you can put it there as well. Really, really awesome bit of kit. The giveaway, the video, we can put the link in the description to the video. All you've got to do is subscribe to the channel and leave a comment on 2 topics, I believe it is. 2 topics that you'd like us to cover in our next live stream. So we'll have a link underneath this video to do that, but you'll be able to find it. If you look through on our YouTube channel, you'll see the live streams, and it's pretty obvious which one is the giveaway because it says giveaway on the title. So go in there if you still want to enter the competition, and we will announce that winner on Friday's live stream. Friday morning on the live stream. So with that being said, hopefully you guys have found this video helpful. Hopefully you found it interesting. If you didn't know what we did in the clinic, and maybe you're just a member of our Back in Shape and you hadn't sort of the awareness of what we do in the clinic with the treatments that we do and how that sort of is mimicked inside the Back in Shape program, now you know. If you found this video useful or helpful, or you know someone else is struggling with back pain, then please do consider sharing and subscribing to the channel. Hit the notification bell as well so you know when we go live. We go live every single weekday. We generally do it in the morning, although there are some exceptions. And with that being said, have a great afternoon, enjoy the rest of your day, and we will see you tomorrow with another live stream.